uh, from Binary Scope Solutions, Samuel Frad, that is going to present open healthcare systems. We have also Maria José Santofimia Romero from InWire Technologies that is going to present technology in response to the aging challenges. We have Gianluca Carletti from Area Lombardia that is going to present Innovation in Europe 2023-2027, where Area wishes to play a role. Now we have here something that has changed. Let me just check here. What we have changed. That is now we will have the database to speed up your analytical jobs. Who's going to present is Bernard Mota and Stefanos Mavros. Please take your seat. So this was a last minute change. Sorry for that. And finally, DG, where to? From, let me see if I can spell your name correctly, Mlesnit Mihai, yes? From the Regional Institute of Gastroenterology Hepatology. So we have all our pitch members present here. We will have 5 minutes, well, you will have 5 minutes to present your pitch. And also, I must remind you that it's mandatory that you stick to this time slot because as the Oscars, we will have some music at the end, just acknowledging that you are finished. Sorry for that, but we have to stick to our time. Afterwards, if you want the opportunity to strengthen important context, to explain better the topic, you can speak during the social event with our members from the summit, other people that are expecting to have further information regarding the topic of your subject. So we will start with open healthcare systems with Samuel Frad.
The time starts when I open the presentation?
I will give you one second.
Okay. So I'll try to be very brief. I'll talk, well, open healthcare systems is a very generic topic, and it will take much more than 5 minutes. So I'll explain a little bit and talk about my company. So my name is Samuel Frade. I'm an informatics engineer. I was also in nursing. So eventually I went and ended up in medical informatics, of course. So I'm here from Madeira, and I was working abroad, and then finally everybody wanted to go on vacation to Madeira, where I was from. So I opened up my company here in Madeira. So since we're here, we have to work with partners because there's a lot of more work outside of this little island. So we have a bunch of partners, mainly Virtual Care, which is in Porto, and it has, I'll talk about them also a little bit. So we basically do consulting in health informatics and develop projects for hospitals and for services. So this was one made for oncology, for a registry for the study of stomach cancer. This one was made for the nursing school of Porto. We had a panel here previously. And this is basically an educational platform, which is actually a registry. So it's a proper electronic health record. And as you fill up and register the data, it automatically says which diagnosis you should be active. And then based on the diagnosis, it should also tell you which interventions you should make and the cycle continues. You gather more data, more diagnosis, or you end closure the diagnosis, and so on. We also did this job for the thermal treatment outcomes questionnaire and follow-up for the Portuguese Thermal Center Association. So basically, it was some questionnaires to follow up to measure the outcomes of the thermal treatments in the patients with chronic diseases. And we're currently working on one scope, which is a one recording and monitoring application that should be hopefully over next year. About virtual care, which is also our partner, they have mainly OpsCare, which is being used in most of the Portuguese country, also in Brazil, in some facilities. For nursing was also done together with them, and they have some other softwares for other specialties. So all this software that we develop between us or our partners are based on the goal and idea of being open, which means basically that, well, previously and normally you'd have many applications working on a hospital or any setting, and that's each application has their own data silo. So the data is in one application, another application has the data on another database, and integration, it's hard to do. Another issue is also every 7 to 10 years, you need to migrate this data to a different application or to modernize, to do some other things. And each migration, you lose some data. So this issue was already solved for images and for documents. So for images, you have standards, which is packs. So the images that are inside the packs, you can switch whatever applications using those images. The images are still there. You don't lose them. The same thing with documents. So the idea is to do the same thing with the structured data. So data is being produced all the time. Like just in the US per day, there's 3 petabytes of information being generated. So all this data needs to be structured and put together in the same standard so that you can switch applications and all the applications uses the same data without loss, without losing its meaning also. So for this, we're basically using FHIR or OpenR. Not sure if you know OpenR as a standard. It's being used now in England. So there's this from a company called Better. And what this does is, well, it enables interoperability, usability, agility. It's also cost effective because you can switch the applications that you're using anytime and still have the data, and the data is the hospital's data, not the application X, B, or C that will ask for your money to give you the data that's yours anyway. Well, this is it.
Thank you, Samuel.
Yeah, thank you.
Almost in time. But in case you're interested in hearing more from Samuel and his speech, he will be available in the social events because this session has no Q&A. So now we have Maria Romero.
Ready? All right, so I would like to start with a question. Like how as a society, we were capable of putting a COVID-19 vaccine in just 1 year, and we at the moment are not capable of monitoring health-related parameters in people suffering from chronic diseases such as blood pressure, diabetes, or things like that. So The technology is ready, is available, is out there. So why are our older others not at the moment making service of that technology? From Inquire, we have identified three main challenges. First of all is that technology is made by young people for young people, that we want to have ecosystem. We all talk about ecosystem, and what we have at the moment is a jungle of devices, a mobile application, a cloud solution, and every single application device require a different interaction mechanism. So it means that most of the time, I will say all the others, but me, myself, are overwhelmed. So it is too much for them to cope with the complexity of dealing with all these different type of technologies. So in Inquire, we are working to deliver a real ecosystem of solution for 4P care, what we call a type of care model that is preventive, mainly through awareness and coaching, lifestyle intervention. We also want the technology to provide prediction. It is something that is there, like a technology is ready to get the data, get a model, and estimate the probability of suffering a risk so that the people can get an intervention as early as possible. We also want technology to be personalized. We want to have the person at the center. So it means that we need to understand the user requirement, what they need, what they really want. And finally, we want them to participate in the decisions that are being made on their health. So we want individuals to be empowered to take the role, the decisions that affect them. So our approach, our solution, just to get that jungle and convert it into a real ecosystem, is that we rely on the smart mirror. Our smart mirror is just a platform that is comprised of several services that are at the moment. We have a call service with a voice assistant, a fall detector, a system for physical activity for rehabilitation. We also provide home monitoring with a sensor deployed all over the home, and also calendar reminders. So here you can see three pictures of the different versions of the smart mirror that we have. In the first picture, you can see the physical activity rehabilitation system. On the second one, you can see the video call service. And in the third one, you have the calendar for reminders. So aging is not a problem to be fixed. We are already, I think we all agree on that, but it is a really great business opportunity. So we are focusing on aging and solution for aging well, but more importantly, we put the focus on multimorbidity and frailty. So just a few data. By 2060, 28% of the population will be older than 65. Chronic diseases are, for the moment, accountable for 86% of the death. And just musculoskeletal disorder cause in Europe 2% of the GDP. So our vision somehow is inspired by the human fascination for mirrors and the role they can play in self-management. So we envision a future in which the smart mirror and a virtual assistant is going to guide us through the aging process in order to have a better quality of life, in order to live a healthier and more active life. So this is all, and thank you very much for your attention.
Thank you very much, Maria. Surprising time. And now, Gianluca Carletti.
Good afternoon, everybody. I'm Gianluca Carletti from Area Lombardia. I'm responsible to develop innovation and international projects for Area. I'm not going to present any project proposal. I'm going to present our project profile and what are the topics that we are interested to develop innovation projects. So basically, the aim of this presentation is to find collaboration. Where you all know where Lombardia is, I think I assume it in case you do not raise up your hand. And Aria, who is Aria? The first question. Aria is an in-house company funded by Lombardy region. We are born from the merger of several companies, and we take care about IT services, We are a regional purchasing body. We are a construction company, hospitals, highways, and recently we have a merger with a body aimed to promote Lombardy brand all over the world. So basically, what do we do? Well, first of all, digital health, as you can imagine. We are responsible for the coordination of the health regional information system. We've been doing this work for about 20 years. This ecosystem is quite important, and the main participants are the citizens, health operator, the family doctors, pharmacy, public hospital. And in this ecosystem, we collect very important information assets, both on the administrative side and on the clinical side. And on this, we, of course, we create and we provide services just like EHR and electronic prescriptions. We have quite a long experience on EU innovation projects from 2007. We focused mostly on cross-border interoperability, as you can see, but also in, let's say, related topics, just like digital identity, cybersecurity, and citizen empowerment. We take care about health data exploitation. Of course, we have an open data portal. It's nice to have a look at our epidemiological observatory that is, let's say, filled up with the data coming from the health regional information system. Of course, we take care of data protection. And the DAS 2.0, it's an important experience that is born during COVID, during Corona time. And let's say it's a framework made of rules, processes, and tools that ensure the collaboration of healthcare authorities, medical scientific company, university, after a process of accreditation and the, let's say, an application project proposal that have to be accepted by Regione Lombardia. What we do now in terms of digital health, well, the main topics are we still have cross-border interoperability, as you can see, but also we are interested in citizen empowerment, data exploitation, and rural area digital transformation. These three topics are related. I don't spend too much time on the projects. We already spoken about Smart Bear today, and you know about it. And another, not only digital health, we are interested, we work on public procurement. As I said, we are a regional purchasing body. We aggregate the needs of the municipalities and on the local body of Regione Lombardia, and we provide purchasing and procurement services. We are even trying to make innovation on the procurement side, of course. And we even had the chance to, let's say, improve our interoperability, the interoperability of our e-procurement platform. Last slide is about environment, energy, and mobility. In Regione Lombardia, we have, let's say, I say interesting project regarding, let's say, allowing limiting use of polluting cars by tracking movement platform and devices that can be mounted on the cars. And these have, let's say, a socially important side because we cannot stop all the cars for, just to prevent pollution. We have the Building Energy Performance Certification Regional Registry and the Public and Private Heating Cooling System Regional Registry. We are making projects even on this side in terms of mobility as a service, interoperability, in terms of data exploitation, and we would like to have projects in terms of smart hospital. We have no international cooperation so far, but we are interested in next generation building a new connected and green hospital conception. I'm done.
Thank you, Gianluca. And now we have Bernardo Mota and Stavros.
No. 5 minutes.
We're gonna split it.
Put it to full screen mode, and we start. I'm Stefanos. This is Bernardo. We are coming from MongoDB Solution. We are based in Amsterdam, and today we're gonna give you some information regarding our main product, MongoDB, which is a database, and why it's a good idea for you to keep an eye on that. Bernardo.
So what is MongoDB? It's a relational database where the main innovation is the columnar storage. This storage mode allows us to excel in analytical workloads, otherwise known as OLAP. And beyond this, we support the transactional full asset properties that every database, every good database should. We have most of the SQL standard, and we're very proud of the very high performance that you get out of the box without user interaction. We feature extensible database functions with the main programming languages. We have a rich ecosystem, so you can deploy and integrate our database in your application stack. And the best of all, we're open source, which means you can try it freely, and you should try it freely to really validate how good it can be. So a few things about our company. This project started in the early 90s in CWI, and the current company is a spin-off that was founded in 2008. We've had quite some contributors to it. Currently, we employ 15 developers, and we have numerous enterprise clients, which we'll go over in a bit. So to just give you an idea about the performance that we promise, this is a performance comparison against some of the biggest systems in the market right now. You might know MySQL, SQLite, or Postgres. And here we can see that for small databases, so on the left and on the middle, for middle-sized databases, we excel in terms of performance compared to them, and we give almost average performance on the big data databases. Since we began, we've worked in quite a few European projects. You can see some here. You might know Human Brain Project, Fashion Brain. So some of these are related to the digitalization of multiple domains. And we also have some enterprise clients that you might know that are using MongoDB in production right now. So, Stefanos?
Yeah, so you might ask, what are we doing here? There is a Vessel AI plenary meeting happening in parallel with the Digital Summit those days, starting by tomorrow. Actually, we're going to have some joint session on Thursday. And just to give you some idea on what the Vessel AI European project is doing, it's about the digitization of the maritime domain. So just a few pilots, information about the pilots that the project has: weather routing, optimal design of energy systems in the new vessels, the management and the forecasting of the global fleet, and even some more futuristic, let's say, experiments, autonomous ships for now for small routes in Europe. And you might say, okay, how do we assist this European project as a database system? Well, you can imagine digitization has to do with managing data, storing them, and processing over them. So what we do is try to cater the needs of that particular domain, which is GIS, geospatial data, and we're trying to improve the support of data types and the processing over those data types through MongoDB engine. So that's what we are doing. If you need more information, of course, you can just ask. And that means that if your domain is using geospatial data, you can also benefit from that, because that's an open source project that you can use for free on your own applications or research. Just to close it, MongoDB is suited for a lot of different domains. Of course, we have high performance, but that's not the only thing that you can use the database for. It's really good for IoT and edge computing applications. We already have well-tested and already in production embedded version of the database. And of course, it can be used for cloud and distributed architectures for whatever domain you have. You can see some of the domains that MongoDB is used right now. We also had a demo, but we weren't aware that it was a 5 minutes, so we're not going into that. We have a solution for cloud-based management of the database instance of MongoDB instance. You can see it on our YouTube channel if you go to MongoDB Solutions in YouTube. And that's all. Thank you. If you have any questions, let us know in at the coffee meeting. Thanks.
Thank you, Bernardo. Thank you, Stefanos. And now, Milesnit Mihai.
Good afternoon. My name is Mihai Mlesnica, and I'm from Romania. I'm a medical doctor, and I'm also hospital manager since 2006. DG, where to? This is the question. The question from the management point of view. The actual hospital used to be a bigger hospital in 2006 with 5 locations with 850 beds. Now has only 2 locations, has 400 beds, and the hospital is specialized in gastroenterology and hepatology diseases. And it runs with 1,200 people. DG where to? So in 2006, it was quite a disaster regarding the IT section. So I started to invest in this part. At that time, there were old computers, not enough computers, no servers, no networks, maybe just a few computers connected to each other, no dedicated servers, only just standalone applications, most of them with Fox, based on Fox Pro with shared folder. So we start to invest. Now we have much more computers, but not enough computers. We have a modern, very fast network, Wi-Fi with general coverage. The locations are interconnected with fiber optic on 10 gigabytes. Also, the building, the hospital has 4 buildings. They are all connected on fiber optics. We have several servers, mail server, web servers, domain controllers. We have virtual machines for servers for different kind of functionalities of the application of the hospital. So we also invest in security. We try to believe we have a secure network. We have right now are investing, preparing the ICU for COVID project to implement in our hospital. So we've made a lot of things. Also, medical equipment are completely modernized at these days in all areas, in surgery, in endoscopy, in laboratory, a full automated lab in all departments. Yes, we have invested a lot, but we have also a lot of wishes. Hope Santa Claus will listening us. And we need more to modernize more and more. We need more apps, but we need more new apps. We need apps to be interconnected with each other. We want to modernize all the IT infrastructure. We want paperless. We need, let's say, tablet on every bed of the patient, of each patient, the patient. And most of them, we want more money. Yes, because in terms of money, there is a quite different between 2006 and 2020. In 2006, the expenses were 50,000 euro per year from a budget of 12 million euros. And this year we allocate about 400,000 euro from a total budget of 42 million. So the question is where to, because the money are not enough always, and the digitalization is going further and faster. And in the market, in my opinion, there is not what I wish. There is no company offering a complete solution to harmonize, to co-aggregate all the apps. So this is the question from the management point of view. Where to digitalization? With what cost? Financial and also human resources. Thank you.
Thank you very much. Thank you for your nice presentations and to complying with our strict time. Sorry to push you a little bit, but this proves that these guys are accustomed to work on pressure and strict deadlines. So I strongly encourage you to reach them and try to hear more about their field of work. Thank you.
we are just looking for two panelists that we know are here, and we do not find them. Just
Hello, finally.
Okay, good afternoon, everybody. This is a long day. We are now in the last session. That is a panel with distinguished guests that are here to address this very important topic, the impact of emerging technologies in healthcare. Before we go, in name of the Secretariat, they are asking me to inform you because there are some of the participants asking about the dinner tonight. So the dinner tonight is not here. The dinner tonight is in a, I would say, really a very exclusive restaurant that is about 10 minutes walking from here. So if you go down to the port, the restaurant is exactly in the beginning of the port of the city, port of Funchal. The name of the restaurant is Nini. It starts the dinner at 8 o'clock, but we have the presence of the minister, so we need really to start at 8. So I appreciate that all arrive to the place about 5 minutes before to avoid the embarrassment to have the minister arriving before us, which is for sure not nice. Okay, so if you have any doubt about the place, you can ask in the secretariat, so in the top of the stairs. But for those that are not for Madeira, you leave the hotel, you go down to the ocean, and you see the port restaurant is exactly there. Okay, now going to the work. First, thank you very much all to be here at this time. I would like to thank very much to all the panelists that were invited to be here and after all to accept to be also here. I intend to conduct this panel in a very light way in order to promote discussion on the vision and points of view of the impact of the emerging technologies on the healthcare sectors. We have here different personalities that represent different kinds of organizations and profiles. So we have here persons like Professor Ben Israel that is addressing aspects related with cybersecurity, or we have, for example, Dr. Christoph Klein with the point of view of the European Commission, or Dr. Katia Ferreira that represents CESAREM, that is the regional body for the healthcare system. So all hospitals, health centers can be seen by them. Besides Professor Gernoux as a clinician, Professor Dalsofer from Tel Aviv University, also in the point of view of privacy and ethics. And then we have also Dr. André Cabral, that is from Philips, so from the point of view also of the technology. So I think we can have here a very nice point of discussion. I don't intend to have a unilateral discussion. I mean, we have the panelists, but the point here is to, oh, sorry, Maya, I apologize. So we have Professor Maya Doneva, Dr. Maya Doneva from EASPD, that is representing really a very important organization and also related to it with healthcare, that is the European organization that deals with the people with disabilities. And it's really an honor also to have you here representing this community that for sure is very important in the society and the impact of all these technologies in the society. So I'm really sorry. I started looking around and I mean, I'm very embarrassed. Thank you very much. Okay, I will start as a trigger for this. I will start presenting a brief video about what has been done during these last 4 years here in the region in Madeira in terms of emerging technologies for healthcare. And taking as a basis that video, I will start inviting the different panelists to give their point of view about what was done and what could be their vision in terms of the next stage, not just, of course, for Portugal or for the region, but in the global world dimension. Let's see the video. I'm sorry, we have some, probably we can do some arrangement in the chair. You can stand. Oh, okay. It's a 3 minutes video. I'm sorry.
If you want to...
Okay, so this video reflects somehow what is called now the Madeira Digital Health and Wellbeing, that was set up as an initiative that provides close to the citizen demonstrations on the impact of the results of 4 major European projects that are running here with between Uninova and the regional government of Madeira. This crosses different domains from well-being, especially in the support of the elderly and the people with some more needs, through integration of the electronic health record systems. In that case, now we are already able to have the regional health system integrated with the interoperable platform that is Smart for Health, that intends to be a reference in Europe. And now we have here Dr. Katia Ferreira, and I have to congratulate the region to have this achievement, because they have really provided the export of the data from the health system to be imported in standard format, in this case in FHIR, so HL7 format, to the platform. And also another one related with telemedicine that is also very important and instrumental at the different points of view. And I would like to start exactly with the Dr. Katia Ferreira, perhaps just give you a brief introduction of herself for those that don't know you, and give your point of view about the relevance of all these emerging technologies on the healthcare system in Madeira. We need a microphone.
For those of you who don't know me, my name is Katia. I'm currently a board member of CESARAM, the Public Health Service of Madeira. I, along with 4 other people, are in charge of managing 3 hospitals and 47 healthcare units. So all public healthcare units in Madeira are managed by CESARAM. Regarding the potential of these projects and digital transformation, I already said it in my presentation, and it's my truly conviction that this is the way for us to have a more sustainable healthcare system in the future. More data, because all these technologies, what they will give us is data or information and knowledge, because they produce data on a daily basis, and with the technology within, we could get knowledge to have better decisions, faster decisions, and more safety decisions. Another thing that I think it's important for projects in the future, or the next projects, is to bring also technologies, not only for us to have better knowledge for taking better care of our patients, but also to take better care of our professionals. That thing that was told this morning is something that we as CESARAM and probably lots of hospitals around the country and the world feel nowadays after this pandemic, is that people are tired. They need to have instruments to do in a better way, in a more efficient way, the job, without being so much time in front of the computer, but me being more time in front or next to the patient. So I think this is the way, but I think also that we have to have some kind of criteria to select the projects we go or the projects we don't go. The ones that create value and the ones that probably just create problems, because we are not starting from the scratch. We already have technology implemented, we already have a system implemented, and we need to select which projects adapt better to the reality we have.
Thank you very much. Now I would move from the point of view from a clinician, and we have here Professor Gernot Marx, that is a very well-known professor also in this domain of the digital health. So what is also your vision about the work that has been done so far, not just in Madeira, but in general around our Europe, considering the digital transformation? And we know that, for example, in your hospital and also in your university, you are a leader in Europe on this respect. And what is your perspective, your vision for the near future? What are the major challenges that you think could be addressed in order to have the next, let's say, generation of digital in healthcare?
Thank you, Ricardo. I think we have to postpone now the dinner. So because
no, we
I
should
need some
finish
time
at
now.
6.
No, I must say I started with telemedicine and developing digitization more than 10 years ago when I moved to Aachen and being in the position to do what I really think was most important. And I'm always amazed that it's really possible to not only doing things better and to establish new technology and to bring people together, but that this really makes a change in the care and in the outcome. So in other words, we can save lives, and we have saved lives already, and we can even save more lives. So this is really my motivation and my vision to the future is that based on all these different projects, including ICU for COVID, we are building now up a reference network on acute care and telemedicine. And these kind of networks are, in my vision, will be a living quality network, because we are more together when we have built up this regionally in Germany, and it's really when we both talk every day, half an hour, there's a lot of trust which will be evolving and developing. And when we establish this with each member state and between member states, we can really make improve the quality. This is what always happened in all these projects which I was involved in. We could really improve quality of care. Plus, especially in the area of intensive care, where we are very digitized, we have a lot of data. We have 1,000 data points per hour per patient. And therefore, AI development is a real reality. It's now, it's happening. And when we are bringing us together via telemedical networks, we can also bring a lot of data together, and we can speed up really, because again, before 2019, before the pandemic, or between 2020, we always said, well, we need digitization because we're getting older and an aging population in Europe. Now we have the consequences of the pandemic, which Paul's probably not here, and I indicated previously. Many people from many professions in healthcare are leaving the job now because they are just tired. And therefore, we really have to speed up to support our colleagues, our teams, in order to have enough people. So it's not a question if, so it's a question of speed up, bringing us together, and securing really the future of healthcare in Europe. Thank you.
Thank you very much, Professor Marx. When we talk about emerging technologies, we are talking about technologies to be used and to have impact. Of course, the impact is direct for those that develop technology and do business with the technology, but my understanding is that the ultimate goal is the citizen, is the persons that will take advantage of the use of this technology. And when we talk about citizens, we are all different. And we have here Dr. Maya Doneva that represents exactly the European people with disabilities. And my question is very simple. How do you see the impact of emerging technology on healthcare when looking for the very relevant community that you are taking care?
Thank you. We do work with social service providers and sometimes as well with healthcare providers that directly support persons with disabilities. And we also talk about digitalization a lot. Actually, our last annual conference in Brussels just 1 year ago was dedicated on digitalization in the social care. And I must say that today I've been just writing bullet points of how different we see digitalization. And I think that's very interesting. For example, the two most used words that we did have in our conference, which again, it was 320 delegates from a lot of countries. We had human rights as number one mentioned. Think regarding digitalization and how digitalization should be based on human rights. nothing for us without us. It has to have a lot to do with co-production and co-designing of services. And the second word that we had was assistive technologies. And I've been just really absorbing what we've been discussing today. And I have to say, I didn't hear, maybe it was me, but I didn't hear anybody mention human rights even once. And I didn't hear anybody talk deliberately about assistive technologies. And that is just, it's not a criticism, it's just a very different point. Because social services use a lot of technologies. For example, if you have a child which is nonverbal because they have cerebral palsy, even though they cannot speak, they can tell you everything. It's just you have the right software, the right tablet, the trained specialists, and it's absolutely working. Or if you have somebody who is severely autistic and they need support to go around Madeira and explore, they have a really nice app, and that's also very easy for them to go around. So it's a matter of different perspective. And if I have to go back to your question, I think the biggest challenge is how to create a person-centered technology when it is so difficult between the both worlds of social and healthcare and then technology. Because we have to create this merge somehow that doesn't offend any of the sides, that is somehow constructive, so we both feel that we are contributing. Because obviously I cannot create an app. I don't know how to do the software that manages hospital, and I can only admire what you're doing. But on the other hand, if the software doesn't function for the end user, not only the patient or the nurse or the doctor, that's also not going to work. So I think that this is the challenge, how to create a person-centered technology, how to have actually the community as the core value of this digitalization, so we can advance both of the sides of this cooperation.
Thank you very much. Actually, I summarize what you said in a very interesting point of view, because these projects that we have been addressed in the beginning as a reference, just a reference, there are of course many hundreds or even thousands others ongoing, is the priority was exactly to move from the technological center point of view, where we developed the technology based on the technology itself, towards the person-centered or the citizen-centered solution. And this citizen-centered solution based in co-creation or in any other kind of methodology seems really to be very valuable for the community that you are representing and addressing. And this is really very, very relevant. And also it comes to me another aspect that indirectly relates very much with what you said, that is the ethics and the privacy. And in this case, I ask Professor Talsofer your point of view in the area of ethics and privacy, and also your foresight in the domain of the impact in the society of all these emerging technologies and healthcare.
Okay, thank you. First, when I think about my long year ago, when we speak about implementing of new technology, I always say technology is not a goal. Technology is not the thing that we need to be in the prior list when we do implementation of the innovative technology. The goal is the person itself, the needs. First, to understand what are the needs, who needs what. And when we understand the needs, we know what to do with technologies. All these technologies that we are speaking or talking all day long and without the emerging technologies are not really new technologies, but still the use of these technologies are really in the really beginning stage of it, and some more, but still we have a long way to do. And we ask ourselves, why? Why it's happening? Why this takes so long to implement? And when I'm saying implementing, not installing, is implementing, it uses these technologies and how to use it. Some of the main barriers when you're looking at it, especially in the healthcare system, is to build trust, to create transparency, to create engagement with all, around communities that you are working, with the patients, with the citizens, with the clinical teams, whatever they are, the doctors, the clinician, the nurses and others, and of course the community, because the community is also the circles around all these that are supporting patients, supporting with the families and other to give them these supports. Understanding that, creating the needs, creating the challenges, give a very leveraged step in order to be the next step to use technology in the right way. The other thing, as you mentioned, is privacy. Of course, we know that privacy is one of the main concerns. And it also refers, I think that maybe after me, my colleague, Professor Ben Israel, will speak more about that. It's maybe more a psychological aspect. It's about the fear. We are sometimes fear about someone that invade our privacy, will take our data, will use the data. But if we will think, carefully, what we can do with this data, what is really can happen. So sometimes it's really needs to be a really concerned, and we have regulations and we have the policy. But still, people are really afraid in the terms of intruding to their privacy. And many researchers and many other studies actually pointed out that although we are all giving our data and giving without even knowing what we are giving and who is using our data, we are still concerned about our privacy. And this is kind of contradiction, we call it the privacy paradox, between what we are giving or how we behave and what we are thinking. And this related to the, maybe my last point is education. One of the main things in order to tackle these things or to succeed in technology transformation, implementation is education. Raise awareness about what we are using, what is that technology asked for, what could be the threats, what could be the benefits, and how we can use it in a more better way. And for that, we also need to create some technology literacy to the young generation, to those who are going to use to be in the workplace and to use it for a better place.
What you addressed is very relevant, but also connects directly to another point that is really critical and generates a lot of questions and discussions, especially close to the citizens, when we ask them to start using digital technology for the use of, for example, of his own health data. We talked about this platform where the citizens are able to provide their own health data to be registered and stored in a platform. We are talking about telemedicine systems or hospital systems or many devices where this data is collected. And the point here is, what is the impact in terms of cybersecurity point of view, considering these emerging technologies that are foreseen, but also about those that are so well established and in use in this moment. Professor Ben Israel, I appreciate your comment on that.
Thank you. Three short points. One is about what we call cybersecurity or protection of data and things like this. We all live in the 21st century. We live in the age of information, which means the dominant technology is computer technology. And we use the computers here and there. AI is only the last development in a series of a long prior development. But we develop computer to improve our life. This is what we call technology, okay, in certain areas, all the areas. But without being aware, we create a weak point because we become dependent on the proper function of these computers. Usually, we don't even, we are not aware of it, but among us, there are also some bad guys. Not everyone is a good guy. And when I say bad guys, I'm starting with criminals that will do something to earn easy money, starting with them and ending with certain countries in the world, etc. and they may use the dependence we have on proper function of computers, not for the benefit of society, etc., but for their own private interest, making money or doing something else. And we don't think about it. Sometimes when we discover it, it's almost too late. Yeah? This is the first. The second one is even worse, connected to the second one, is that when we realize it, usually we think only about intervention in this or that way in data. I mean, the bad guys may steal our data, encrypt it, prevent us from using our telecommunication or anything else by cyber operations. We forget that they can use the same technology of hacking into computers and doing something with the software, not in order to modify the data or do something to it, but to cause physical damage. Okay? You can hack into an airborne computer in order to make some disorder in the world traffic, etc. But you can do the same for causing the aircraft to fall down, which is much more serious effect. You can hack into a hospital, not in order to do something to the IT systems in this hospital, but to do something like, for example, you can change the software of the machine that reads the barcodes on the blood in what we call blood bank, okay? And instead of reading it as type A, it will read it as type O or type, and then many people will die. It's a physical damage. It's not damage to the virtual space of data, okay? And this we have to take to bear in mind, and it can happen also in the health system. It's not only for other things. And the third point is about human factor, and which this is the most difficult factor that we have to overcome here. Technology, in a way, is an easy problem. You know what you need, as you said, you can find the right technology to solve it. But in order to implement it, you have to overcome human nature, which have not changed in the last 2,050 years or so since Homo sapiens started to walk on Earth. Okay? The same, it's very problematic, and I'll give you one example, and by this last point I will end my short remarks. I was appointed by the government of Israel to submit to the government a plan, actually to repeat the same exercise that I did in 2010. 2010, I was asked to submit to the government a plan to make Israel one of the top 5 countries in the world in cybersecurity, which worked. Now, please, 2018, please do the same for AI. Okay? And like the first time, I realized from the beginning that we should take care of the whole ecosystem. It's not only technology. Technology is only one element here. It's education, how you have to educate kids, how to live in this new world with this new technology, etc. All the aspects. And one of the elements was defining some projects in AI that will get more or less immediate results to demonstrate to the people, to the politicians, to those who give them money, etc., that this is not philosophy, pure philosophy, or something very basic research. You can get results. One of the areas that we chose is, of course, healthcare, which is a very natural area, and people come with bright ideas like you take a genetic data file and cross it with a clinical data file, and this and this and that, and you can do wonders in healthcare. And the subcommittees that I appointed to give us recommendations for that failed to do it. And not because technology cannot do it. Technology can solve this problem easily. The problem was human nature. I mean, what do you mean by taking this data file and cross it with that data file, etc.? All these data files are held by different organizations. You need all of them to share the information, and they don't want to share. So you said, okay, we are the government. We can regulate something that will force them to give the data, but then they come with very real arguments like we don't have the consent of our patients. I mean, this is not our, we don't own the data. It's the data about human beings. And they are not, I mean, we are not speaking now about someone who is sick and is ready to sign anything to heal, okay? But we speak now about data, clinical data, or other, without their consent. And of course, I don't know the character of people here in Madeira, but I can tell you in Israel, you ask people if they agree, they don't. They look very much, I mean, they keep, I mean, they don't want their privacy. It's a private information about not only me, my parents, where did they come from, what, etc., etc. They don't agree. So what do you do? Privacy, as you said, or human rights is a real value that we don't want to get rid of, okay? What do you do? And then they use these arguments, which are heavy arguments, not something that we can ignore. And at the end of the day, we decided, I mean, someone pointed to us that there is a group which is not so sensitive to its privacy, and they don't sue, they never sue the hospital, the doctors, everyone for what wrongdoing was done to them, etc., etc. And these are vegetables, not human beings, vegetables. They have DNA, they have history where they were grown before, etc., like clinical. And at the end of the day, we came a project which will not improve human health, but which will improve the agriculture. It's agri-food. Only to do something that will demonstrate that we can do it. We hope that after people will realize that it gives results, they will agree, be more come forward to agree to this. And in healthcare, we chose other projects like intelligent machine that will determine your place in the queue to certain healthcare services and things like this, which do not meet this human nature that is resisting. I mean, technology was always accepted by people with a fear, always. I'm not speaking about digital technology. Yeah. Okay, every technology, even knives. Okay, every technology was received by people with a lot of fear, and it takes a long time to agree to use it.
Thank you very much. So thank you very much for your point of view. And now I would ask, because we cross all over different domains, applicational domains, also transversal domains, and now we go for the technology itself. And we have here Philips represented by Engineer André Cabral. That, okay, Philips is a major technological provider in the world. I think everybody knows the company. And the point here is exactly you, as a technician that is connected with this organization. How do we see the impact of the emerging technology, not just in the health sector, but in general in the society, considering all the coming challenges that are now resulting in new products, new devices, new solutions, new whatever?
So thank you very much for the panel. I think being the last and most of the things are very relevant to what defines our strategy as a company and as someone that wants to influence the transformation of healthcare in the world. I really think that technology is just a mean, and I really believe it when we are in our company deciding what to put our bets on. And I heard a lot of comments, and I really believe that if it's not to solve people problem, it doesn't mean anything. It's just money, just making profit out over products. And I think that we are on the bridge of taking serious decisions in healthcare. And by using technology, we can speed up a lot of that transformation. I think that when we are, as a company, looking at the way we want to influence healthcare, we always look first and what would be the impact. And you mentioned citizens, which I liked a lot, because you didn't mention patients. And why citizens? Because we can influence the ones that are being needed for help, so the ones that are in the hospital. But we also need to take care about the resources that they have as a country or as a region. And we need to ensure that my taxes are well invested in what would be the needs of healthcare, as, for example, once we are impacted with COVID. So I think that for starting, we need to understand that we need to bring a value to what would be the need of a society, citizens, patients, and even someone that needs to decide as government authorities. The second part, I think, that you mentioned, and I will make just a short bracket to complement the strategy of Cesaram, because what we see in a lot of the countries is that the decision to transform does not to be pivot on technology. It needs to be pivot on the vision that we need to bring to the patients, healthcare, and the healthcare professionals. So the other point that I would like to mention is that when we are designing, we are understanding that behind the technology, there's a number of professionals that right now face a lot of challenges, and they need to be supported to take better decisions. So to understand that, for example, in Portugal, we see that we are facing dilemmas, and the healthcare professionals are facing serious dilemmas to decide on how to manage their own resources, time, and the effort to treat all the patients. So I think that we also have the responsibility, being a technology provider, to also understand on how those professionals need to take their decisions. Lastly, I think that the cost is a very significant part of the equation, because if we look, we are not, what we saw during COVID is that most of our governmental budget was need to be assigned to face the pandemic. So what we need to ensure is that when we face this kind of crisis, we have a healthcare that is prepared to give response, and it's not reacting as we unfortunately had to do during the COVID. So I think that the most advanced healthcare institutes, hospitals, private sectors that needs to look forward to what we are building are the ones that understand that we need to build a healthcare connected. And I will finalize with a data comment, because I think it was very interesting that what you mentioned around privacy and how we deal with data. We believe that transforming digitally the technology in healthcare, we will bring a significant amount of data. So healthcare is the industry that is bringing 30% of the data being collected worldwide. So it's a huge bucket. You wouldn't find any industry that is collecting so many data. And the importance of having that data is to make it very actionable. So for doing that, we also need to understand that the ecosystem needs to be connected. So I do not need to bring my own solution with my own interoperability device, which I have my own data. That's past. So we need to understand that we need to bring a very open system that we can connect with each other. Solutions with solutions, companies with companies, healthcare industries with healthcare industries. So the way we see it is that we need to provide, as Philips, the solution to connect all the dots in the healthcare system. It's not just bringing the device, because we will try to bring that device also, but that will be just a mean to reach the common target, that is to impact health of the cities.
Thank you very much. Thank you for your point of view. And now it comes for the European Commission, where the European Commission, as most of we all know, during these last years developed two major programs that address somehow the digital technologies and digital transformation. One is the Horizon Europe, and the other one is exactly Digital Europe. These two major work programs intend, in my point of view, to support Europe and we all in this transformation of the digital, in the introduction of the digital in the society. And I would like to ask Dr. Christoph Klein, that is the leader in Europe for the health cluster, and for sure one of the persons that is more aware about the implementation of the strategy in Europe. What is your point of view along these discussions and in terms of the expected impact of the emerging technologies in the healthcare sector? This is the focus for today. And what are the major challenges that you think we can face, not for the development of the solutions, but for the Commission itself to assure that the metrics, the performance indicators that you intend to achieve will be reached?
I think this is not to be answered at the time frame today. Nevertheless, I think, let me say, thank you for the invitation. I give you my personal and private thoughts to the items that I have.
It's on, yeah.
That I've heard now. It's there. For me, there are a couple of dimensions. Certainly, it makes it easier to have a vision if you look at it from a company side. Although there's all good intentions in it and all kinds of proper approach to go forward. As a regulatory body and also as a major funding organization, this is completely different. We heard human rights, we haven't heard. No, we have responsible research and innovation as a principle, as codes of conduct, as we have the GDPR, and we see already there is legislation made, regulation, policy formed, that we do not have to rediscuss this always, but that we absorb it as a principle. And I think it's the beauty that we didn't need always to say it, but we all think it and hopefully live it. And this is somehow also the approach that we need to absorb. How do we make this thing working? Some of us are more enthusiastic about technology as per se. Some of us are rather anxious. And that's a beauty in society. We are all different. We respect this. We are inclusive. We want to see people. People are not subjects, individuals that we collect data about or they provide data about. It's also us that use technology as actors that are using enabling technologies. And so it brings us into two positions. How do we use it in our daily life and work, professional life, but also in private life, where I'm getting enabled to take care of my own health or to be conscious about in which situation I would be. Am I possibly already at risk because I have developed some issues, anxieties, psychological issues, items which go often unnoticed. I think we have many levels here in the societal system which go together with living, healthy living, and with healthcare and healthcare provision. So for us, let me point at two key documents and strategies. Digital transformation of health, in the communication from the Commission in 2018, April, most of you will know it or you find it easily. We look at making it across member states interoperable to develop tools in a citizen-centered design, user-centered design, and in a responsible way to be developed. We look at paving the way for a responsible approach on a clear basis of your personal data being protected, which brings us into the problems or the natural barriers that you have well described. Will we be in a position that we cannot do anything? Probably not. Maybe we are working around solutions that are working without everyone giving everything. So we are developing algorithms of developing understanding at the occasion of local knowledge that is generated, which can be shared as knowledge without giving all the data that are underlying the knowledge. And all these facets come together. It is not about technology versus people, and it's not static. And I said this today earlier. And this is what we need to see. Us people and us societies, we are in flux, we are changing our habits, our views, and we are all different, which is the beauty also in Europe. And we have technology that is developed, and we are more or less enthusiastic. So this is enabling, but still it's a beauty to see technology is there. And the point for us to see, like in the second document, like a health, like the care strategy, to lead to a continuum between healthcare provision and care and social care, which are all not separated. This is more or less a very continuum of the thing. This needs to grow more together. We have systems that are not fostering this, but many of the things when we look at enabling technologies, healthcare technologies, and digitization point in this direction. We need to think out of the box of those confinements, and we need to see how skills in education can make use of digitization as the part of technology-driven items that bring us forward all together without imposing how much you have to go and about imposing who you need to be. And this is by far not easy, but this is the way that we are going.
Thank you very much. As a wrap-up from all the panelists, and before move to questions that can come from the audience, and in order to close the session on time, so we have about more 10 minutes, Professor Tal Sofer it was very gentle, preparing our point of view, considering the impact of the emerging technology in healthcare, from challenges to opportunities. This slide is just presented now because I would like to have a first overview of all of the panelists before I have your, let's say, description about your slide that for me is really very relevant and reflects very well all the aspects that have been addressed here. So please briefly give us your insights about this slide that you kindly prepared, and I took the liberty to show here to everybody.
Okay, thank you. I think it's when you look for yourself at this slide, it's actually a wrap-up of what we discussed all day today. Closer. It's kind of a wrap-up of what you discussed all day today, along the day, and mainly when we speak about the impact of emerging technologies, and we're speaking about from challenges to opportunity. When I started to think about it, I started to think who are the main groups or areas, stakeholders, as we call it, that are really benefits from technology. And I already spoke about it. We have the medical staff, we have the citizens, can be patients, and the community. It's really obvious what are the benefits, and we can see it all over. But I think that the most challenging or the most important is to look to these sides and to see what are the main challenging and how we can leverage these challenges. And we speak a lot about trust, transparency, and what also I tackled during actually my participation in the project is the need to bridge knowledge gap, to increase engagement. That goes to increase awareness, what it's all about, and I already mentioned that. Also, one of the points we discuss and have a lot is the bridging the language gaps. And language gaps, it's not about the language between countries, you know, from Portuguese to Hebrew to English, etc. It's between different fields, between people who speak technology, people who speak the social aspect, and people who speak the clinician or the medical aspects. All meant very, you know, for the same thing, speaking different language. And these kind of things needs to be bridged in some way, and we need to educate people how to do that. And of course, we speak a lot about the social inclusion and polarization, how we can take these benefits of the impact of technology into this aspect. And for all of this, we already spoken somewhere about policy and regulation. You mentioned that, Christoph, very well, that we have policy regulation, we have the GDPR, we have other national regulation policy, but also we have to bear in mind that policy and regulation is to help us, and not to give a burden or to create some obstacles. And this is kind of a balance between how we can use it and for what. And the last one is education, education, education. And I think this is the key for all of us. We spoke a lot about what is needed to be done in the education system. And when I speak about education, it's for the kindergarten till the end of your life, like lifelong learning, as we call it. It's not starting at the university. It's starting when you're born. And that needs to be your path of life, specifically when technology is so changing and our life is, we call it the VUCA word, when you don't really know what will be tomorrow. So sustainability and resilience will be built upon these things. Thank you.
Professor Tal, thank you very much. I really appreciate this slide because I really identify myself with really the major keywords for the impacts of the emerging technology in healthcare: fast, adaptive, flexible, anytime, anywhere, anyone, and in this triangle: medical staff, citizens, patients, but also the community in general. So it's very well spotted slide that I really appreciate very much your time and your, let's say, your opportunity to present it here. And now probably it would be nice to move to the audience for some questions. We have already, at least I see 3 candidates with questions. I'm not sure if we have a microphone from there, or if not, probably if you can speak louder, we can listen to you. I don't think it's necessary. I think, can you speak louder? Yeah.
Okay. I will try to speak quite loud. I'm I want to ask a question, even to the US, citizen or patient. Do you think this emerging technology in healthcare in general will help to reduce health inequalities in the countries in Europe, or develop new ones? We have seen, for example, in AI with bias depending on the set of data you are using, or the cost, because a lot of solutions are developed, but there's no funding at all to use them in the real life. So my question would be really, is it a way to help to decrease health inequalities, so we can think about getting the opinion of a professor from one country helping another one, but no specialist, or developing new inequalities that will be linked with your social conditions or a lot of factors that can arise from
Thank you very much. To know who would like to answer this question.
Thank you very much for the question. I think that inequalities can be, in a way, reshaped to grow or reshape to disappear with changes. Depends how we use them. And you know, in medicine, they always say that the magic is in the dose. With one thing, you can have a poison at the end or a medicine. I think that the COVID pandemic showed a bit that if we overuse technology, we create even more barriers. And we tried, I think, in the beginning very successfully to use technology as means for facilitating communication, which was very necessary and very good. And then I think that maybe each of us individually found the border where it was not only facilitating, but it was overwhelmingly enough. So to answer back to your question, I'll go back to the values of how we use this tool. All of you mentioned that this is a means. Technology is not a solution. It's not the universal answer. You know, in the Hitchhiker's Guide, there was this computer that was supposed to answer the most powerful question. I don't remember how it was framed, but then when they built the computer and they figure out they don't know the question. And I think that with us, the situation is like that. We have to be sure that, however, and I'm focusing on this slide on quality of life, and I really, really applaud you for adding this, because the quality of life concept is so not new concept. It's been here for a while. And to measure only quality of services or quality of healthcare, measuring how many fire extinguishers and sinks or computers there are, makes zero sense. Quality of service and quality of healthcare has to have a direct link with quality of life. Otherwise, we're just measuring something else, which has no meaning, and that would end up creating more gaps rather than bridges.
Thank you very much. So any other question, please?
Well, this is a magnificent panel, and I'm sorry, I'm going to ask a question to the moderator and Ricardo in evidence to Beckett. Because yesterday, my name is Paulo Nunes de Abreu. I'm the founder of Hospital do Futuro and Health Data Forum. And yesterday I was in the inauguration of Bayer, a multinational company that is facing 10 multiple challenges at the same time. And these kind of pharma companies now, they're becoming like global investors. They have huge billions of dollars, and they invest in startups that are supposed to solve the problems of today, right? Even in elderly care, special needs, you know, these startups are doing amazing things. And one thing it was mentioned in the panel, and this is for you, Ricardo, because I think it's a challenge we face in Europe, and this is mainly a European Union event. 98% of the funds that Bayer gives globally are for startups that are based in the US of A. Only 2% goes to European startups, and this is the challenge for you, Ricardo. How can we overcome this?
I thank you very much for your question that I'm very happy to receive and forward directly to the representative of the European Commission in order to have also his point of view, because actually this is absolutely important indeed. No, seriously, Dr. Klein, I'm sorry for my informality, but this is a very serious question, and my forward question is because I don't feel the competence
You didn't arrange
to
this
give.
beforehand.
No, no, it was not arranged.
Okay.
No,
it was
no,
a bit
it was
like
not.
this, but I trust it's not. No, I mean, I can certainly comment on how funding from the European institutions would be provided. But you were pointing at 98% of a private company investments, correct?
No, the funds, the Bayer funds that funds innovation in startups, and 98% of these startups are from the US. Only 2%
Yeah, from Bayer. It's the policy of Bayer. Yeah.
Well, I think it depends on the fact that the US is more attractive for business rather than Europe being at
Okay, no, I'm completely with you. I just wanted to be sure that we have a good starting point there. It's certainly also a different culture of funding in these two regions. It's a totally different culture of how the funds are, how innovation and research is run and performed. We are, I think, if I may speak about the funding that we provide, we are also not shy to invite other countries to participate into performing research and innovation. Investment into pharma and small startups as a company policy is one thing. What we do from the Commission is a totally different thing. We look at the portfolio of what we need, what we agree to put our funds on, to also have the mission-driven approach, and to put it into the regulatory portfolio. So this would be a totally different thing than your question. But I'm looking into this round whether somebody would like to really target the question. Beyond the answer, it's a company policy.
I suspect it's a company policy, okay? And I'll give you a counterexample, okay? It's from a different field, but I'm speaking now about cybersecurity. You can ask yourself, how much money is invested by business sector? I'm not speaking about one company, okay, like Bayer, by business sector globally in cybersecurity. Investment by business sector alone in cybersecurity, and then you ask, okay, you sum it all up, where does it go to? To the US, to China, where to? In cybersecurity, I can tell you that the percentage that goes to Israeli companies is 44% of the global investment by business sector in cybersecurity, 44%. How come? No, it's not because you don't speak here about one company or two companies that can have certain policy, especially when it comes to pharma. Even Israeli companies are preferring the US than other because of other reasons, FDA, etc., etc. When it's open, okay, it depends on many other factors. So it's not something written in the Bible or something that you can do lessons. This is my own opinion. Forgive me for this.
Thank you very much. We have time just for a very last question, if any. Okay, so I think also that we are already on time to close. I would like just to wrap up in short what was said here in this panel. First, thank you very much. I'm very honored personally to you to accept to be here. It's really an outstanding panel, so appreciate it very much. And my summary from all this discussion is that indeed, in terms of impact of emerging technologies on healthcare, technology results in a mean, but the focus should be exactly on the citizen. Next stage of emerging technology for healthcare. And stakeholders, hospitals, health services, health centers should be sure that also these new technologies are suitable and ready to solve the problems and not create yet another problem, because I don't think this is what you look for, because probably you have already enough problems inside all your organizations. And finally, but not the least, is related with the point of view of the use of the huge data that is produced by the health sector, that I understood is really one of the biggest sectors that produce data, and the way where clinicians can use that data using technologies like AI or big data analytics to support them in the activities they do, and also as a decision support system. Privacy, security, ethics are for sure important. Companies need to really respond and deliver with better and more adapted technology, and for sure the European Commission will be here to provide guidance and funds in order to enable us to progress and become our world, and in this case, Europe, even a better place, with the ultimate goal, as already was said here, saving lives. Thank you very much for all for coming. Please be a little bit before 8 for the dinner. And tomorrow we start at 9 o'clock. We have also the honor to have the mayor of the municipality of Funchal opening the session. So it will be, let's say, important that if we all can be already in the room to welcome him when he arrives, because he comes with the media, with the television, so you saw it this morning. So it's important that we are already in a room to avoid delays, and we start the session. Thank you very much. Have a good evening. I'm sure you will enjoy the dinner tonight. It's a very nice one.